Happy Wednesday, everyone, and welcome to episode 5 of Let the Adventure Begin. Today, we're talking about choosing the right pediatrician for your family. We're joined by Dr. Ann Maschantonio. She's a pediatrician at ChristianaCare Pediatric Associates in Newark. Dr. Maschantonio, thank you for joining us. Please take a minute to introduce yourself.
Hi, Megan. Yes, my name is Ann Maschantonio, and I am a pediatrician at ChristianaCare Pediatric Associates. And I'm grateful for the opportunity to talk to viewers about choosing your pediatrician, which is a very important decision.
And this is not a new topic for you. Give our viewers some insight on how long you've been treating the babies of the Newark area.
Well, I've been with Christiana, including a residency, for 18 years, 15 years in private practice, and then with ChristianaCare practice.
Fantastic. So to all of our viewers, if you have any questions for Dr. Maschantonio as we go through this conversation, please put those in the comments below, and I am keeping a track of those, and we'll get to those throughout our conversation. So let's start big picture. At what point should parents-to-be start thinking about choosing a pediatrician?
Well, choosing a pediatrician is a very personal, individualized process, but it's an important decision for you and your baby. The timing of choosing your pediatrician will vary. Some parents want to choose their pediatrician well in advance of the baby's birth, some even before the pregnancy, actually. Others are happy to choose based on the guidance of their obstetrician along the way in their pregnancy. And others are happy to choose based on the advice that's given to them by the labor and delivery nurse when they're ready to deliver their baby. And I think all of these approaches, work well, but I would strongly recommend asking family and friends who live nearby, who cares for their children? What is their experience? Word of mouth, reputation, and location are all very important when choosing your pediatrician. And others also, I see on Facebook, there's neighborhood groups and different mom groups or dad groups or dog owner groups, and they post questions about pediatricians. And so that's another good access or another good information source for choosing your pediatrician.
So other than talking to friends and family or potentially those mom groups that you're a part of on social media, what should new moms keep in mind when choosing a pediatrician? That long list of questions they should be going in with.
Yes, absolutely. I think you really want to make sure that your pediatrician's office has a good reputation, like I talked about, word of mouth and personal experience with friends and family, but you want to make sure it's a well-respected practice within your community. You'll want a practice that is near where you live and accepts your insurance. You want a practice to have easy access in terms of office hours, availability for making same-day sick appointments, scheduling well appointments, well in advance. Do they offer weekend and holiday office hours? Very importantly, you should be able to reach your pediatrician after hours for any emergencies. And what kind of system do they have in place for this after hours emergency connection with your pediatrician? It might be important to you for your pediatrician's office to offer other services at their office, such as a lab on site where we could do rapid strep cultures, rapid flu tests, rapid strep test and rapid flu tests. Also, other cultures, just other things that we could do in a lab situation. Does the practice offer lactation consultations? Does it have an embedded mental health provider and offer mental health visits? Does the practice have access to referrals for pediatric subspecialists and therapists? All very important features. So something you want to look into. But I think bottom line, the most important thing is, how do you feel as a parent when you're meeting your pediatrician? Does she or he make you feel comfortable? Are you confident in your pediatrician's ability to care for your child? Does your pediatrician make you feel confident as a parent, patient and listening to your questions? And I think those are probably, with all the other things aside, how does your pediatrician make you feel as a parent caring for your child?
Absolutely. So let's transition to that first appointment. You've chosen a pediatrician. You're now going to that first appointment. Should that first appointment be in the hospital, or is that something that happens afterwards? How does that work? And what should parents expect during that first appointment?
Another great question. So it depends, it varies. So some pediatric practices do see their newborns in the hospital when they're born during their stay, but many do not. It can be difficult for the general, practice pediatrician to do both. So I can speak for ChristianaCare. So here they have a brand new women's and children's building that delivers approximately 6,000 babies per year. And as such, they also have a large pediatric hospitalist service. And the ChristianaCare hospital pediatric doctors are in the hospital 24 hours a day, every day, caring for newborns, assisting with deliveries, managing sick and drug-exposed infants, as well as collaborating with their on-site state-of-the-art neonatology center and with the community pediatricians. The pediatric hospitalist will care for your baby while you're in the hospital and then discharge you to the care of your chosen pediatrician. This works very well and is the most common strategy amongst our regional pediatricians. ChristianaCare Pediatric Associates sees newborns in the hospital. It's an experience that we value deeply. And I think it's possible, mostly because we're located on the Newark main campus alongside the women's and children's buildings. And that allows us to see, our babies in the hospital 365 days a year and see patients in the office 365 days a year. But either way, whether you're seen by your private pediatrician or the hospital pediatrician, you will be expect to visit with your outpatient or your office pediatrician within 2 to 3 days after discharge from the hospital.
And how many appointments should you expect in those first few months of life?
So it's a lot. So it's really important that you like your pediatrician because you're going to spend a lot of time with your pediatrician. There are many appointments in the first year of life after the baby is born because there's an explosion of growth and development, and there's so much change going on in your baby over a short amount of time. So you can expect to visit your pediatrician 7 times between birth and 1 year old. It's a lot of visits. Your pediatrician is going to closely monitor your baby's weight and height and head circumference, making sure that your baby is growing at a normal and healthy rate. Every visit, your pediatrician is going to ask you several questions about development. Is your baby holding her head up? Is he looking at you, smiling, reaching, mouthing objects, laughing, jabbering, standing? Stranger danger, forming words, walking, so many questions that change very quickly over the course of that first year. All of these developmental milestones occur in a fairly typical pattern over a range of appropriate kind of time intervals. And your pediatrician will make sure that your baby is growing and reaching all of these developmental milestones at appropriate ages. So all of this, in addition to making sure your baby's physical exam is healthy, and providing reassurance and advice about all the changes involved with raising, all the challenges, of raising an infant into childhood and then into adolescence. We actually have a well visit schedule link that we can put up here too, so families can get an idea.
Posting that in the chat as we speak.
Oh,
so
wonderful.
That is in the comments now below, a little bit of more information on that well visit schedule, because I know as a soon-to-be mom, as soon as you said all the questions they're going to ask, I was like, I should have a pen and paper with me, and I'm the one asking all of these questions myself. So
just as an aside, so I think some practices, most practices, we hand out a sheet of paper that basically outlines every visit from birth until 18 or 21 years old, depending on your practice. So every single visit is listed. Vaccines are listed as to which ones they're going to receive at those visits. And a lot of parents have told me they put that in their pantry, or they put it in, they scan it in their phone. So they have a game plan of what to expect as far as office visits.
That I'm sure other new moms will agree. I'm looking forward to the physical piece of paper. That will be very helpful. Absolutely.
Yes.
So you mentioned vaccines. Let's talk a little bit about that. I know there's another link that I can share in the comments in just a second, but run us through, how many vaccines, which ones. Obviously all people talk about right now is the COVID vaccine. We're in flu season. So we at ChristianaCare are also really discussing the flu shot, but there are so many other vaccines that babies need in those first few months of life.
So yes, I think, first off, flu season has arrived, and we strongly recommend that your child 6 months and older receives the flu vaccine annually. Very important to receive that vaccine. The COVID vaccination is not approved yet for children under 12 years old, but it will be coming. So I encourage you to talk to your pediatrician about COVID vaccine. But as far as the other vaccines, there are several vaccines administered in the first year of life. I can't really tell you the number of vaccines, only because it depends on which manufacturer vaccine your pediatrician uses. So as far as number of needles, I can't really tell you that. But I can tell you that you can expect your baby to receive vaccinations at every single visit between birth and 18 months old. Vaccines are safe and effective at reducing your baby's risk of serious or life-threatening infections from bacteria and viruses. The number of vaccines may seem like a lot to some parents, but in fact, it's not a lot of vaccines. And I like to explain it in the following way. The infant's immune system is essentially non-existent at birth, and the baby acquires its immune system through maternal antibodies in breast milk and through exposure to germs over time, with a lot of exposure to germs right after birth. So again, I like to explain to parents that vaccines are like sending your baby to germ school. The vaccine provides a formal education by mostly injecting your baby with an inactive form of the virus or the bacteria. Your baby's immune system will study this harmless invader, learns about it, develops antibodies to it, and then stores those antibodies into its immune memory. So that one day, when the real live virus or bacteria enters, the immune system education is ready to fight off the living, scary invaders. So pediatricians recommend the vaccine schedule per the American Academy of Pediatrics and the Centers for Disease Control guidelines to significantly reduce your child's risk of serious and life-threatening infections. I would say that vaccinations are the greatest invention in the prevention of pediatric infectious illnesses and keep your children safe and healthy. So please, if you have any questions about vaccines, ask your pediatrician. I assure you, they will be happy to discuss it with you, handing out information, links to reputable websites, including the American Academy of Pediatrics and the Centers for Disease Control. And we can also provide you links to both of those sites' recommended vaccination schedules.
Yes, both of those, the CDC link to the vaccination schedule is now in the comments below for anyone who was looking for that. And while we're on the topic, I know we mentioned flu in the very beginning of that question. Obviously, newborn babies who are going to be born during flu season, like mine, can't get the flu shot, but I know I received my flu shot about 2 weeks ago. Touch on a little bit more about the importance of pregnant women getting that flu shot to help their babies.
So it's very important for mothers to receive the recommended vaccinations during pregnancy, one of which is going to be the flu vaccine. Remember, we cannot immunize the baby until the baby is 6 months old. So any immunity to influenza infection that a baby is going to have is through the maternal antibodies through the breast milk. And if you don't breastfeed your baby, then at least you're protected against the flu, ideally, so that you won't get sick with the flu, and it decreases your chance of transmitting flu to your baby just by contact. So very important to get your flu vaccine, safe to get it during pregnancy, and really beneficial to protect your baby until your baby's old enough to receive that vaccine at 6 months old.
And I know Tdap as well. I received at an appointment a few weeks ago.
Yes, Tdap is also important. We want mothers, your Tdap should be boosted every 10 years. And during pregnancy is the perfect time to get boosted against Tdap, which is tetanus, diphtheria, and pertussis. We find that adults who are lacking in immunity to pertussis are the reservoirs of pertussis infection, which can cause whooping cough. So getting vaccinated with your Tdap provides immunity to the baby against whooping cough, which is a life-threatening illness in infants.
Yeah, let's touch on RSV a little bit. Unfortunately, hearing a lot about infants an RSV right now with just the time of year that it is, and it being, COVID and the flu, and is it, what is it, and what is your message about RSV?
So RSV is the actual name of it is respiratory syncytial virus, and this is essentially a common cold virus, but in infants, it's a nasty player. It just gets in quickly, gets down deep into those lungs, causes an upper and a lower airway infection with lots of inflammation, cough, work of breathing, wheezing. It's very, very serious in the younger infants. So there is no, regular vaccine schedule against RSV infection, but it is most common during, the winter months, fall and winter months. So what we ask that parents do is just be really careful. Try not to take your baby out to big gatherings, certainly not hanging out with anybody who's sick or has a cold during the first couple months of life. An adult, it may just be a cold, a runny nose and congestion and a cough. But if it's RSV and it infects your baby, it can be very, very serious. So anything we can do to prevent spread of any infection, viral respiratory infection in babies, RSV, definitely want to try to keep your baby out of RSV's harm way.
Absolutely. Is there anything else while we're on this topic of vaccines that you wanted to share today?
No, just that, we, as pediatricians, it's really such a great tool in our arsenal in preventing, serious illness in children. And so I encourage you to ask your pediatrician. I encourage you to receive the vaccinations that are recommended. They are safe, they are scientifically proven, they are recommended by reputable foundations and groups such as the Centers for Disease Control and the American Academy of Pediatrics.
Fantastic. Now, Dr. Mastantonio, if someone is watching and saying, oh, I need a pediatrician, how can they get in contact with you? Give us some information about your practice, ChristianaCare Pediatrics as a whole.
So certainly, ChristianaCare provides a lot of pediatric opportunity to see your children. So we can provide the ChristianaCare Pediatrics webpage link. And you can find, when you go on there, it's a great site. You can find several practices who care for infants, children, and adolescents. First, you'll find a site map to see, where you can find one that's located in your general vicinity. But there are different types of practices at ChristianaCare that see pediatrics. The first type of practice would be an exclusively pediatric practice, such as my own practice. We strictly see pediatrics at birth in the hospital up through, actually, we go to 21 years old. And then there's family medicine practices who see children up to, birth up to 21 years old as well. And then there's another group of the internal medicine and pediatric practice. So these are doctors who are board certified in both adult internal medicine and pediatrics, and they can care for your children as well. So all of these practices can take care of, newborns, toddlers, children, adolescents, and then into young adulthood. At the site, again, you can find information pertaining to, each site, the contact information, their office hours. You can look at the provider biographies and their photographs, and I find it is a very useful guide. Specifically with regard to pediatric associates, ChristianaCare, this practice is open. You can find us on the webpage as Pediatric Associates at the Newark campus. We also have another office at our Whitehall, Middletown, Delaware site. That's a new site, but it's part of Pediatric Associates. And specifically, this practice has, 9 physicians and, 4 advanced practice providers. We're a large practice, and as such, we see our babies in the hospital. We offer, care within the office 365 days a year, including holidays. We have an answering service after hours. We have lactation consultations. We have an on-site lab. We will soon have an embedded mental health provider. And we do have a great connection, with all of our subspecialists and therapists in the community, so we can get quick access for, babies, children, adolescents, to whatever therapies or subspecialists they need.
Absolutely. I know personally and professionally, one of the perks of ChristianaCare is just how connected we are as a health system. So anything you need can certainly be connected so quickly from provider to provider.
We really are. I'd just like to add too that, we have an amazing, like I said, a pediatric hospitalist system here. And we also have, like I said, a state-of-the-art neonatology center that, because, we are pediatric associates, we are ChristianaCare and we are on site, we have this, they really worked hard at creating communication between these different, departments in the continuity of care of your child. So we are speaking to the NICU. They're speaking to us. We're receiving discharge information. Same thing about the Christiana hospitalist. So it just, a lot of effort went into seamless continuity of health information within this particular institution, and it works very well.
Yes, absolutely. It's so important. So before I let you go, what is the most important thing you want new parents to take away from this conversation today?
I want you to like your pediatrician. I think, I always make the joke that you don't have to necessarily like your family doctor or medical doctor, no offense, but you have to really like your pediatrician, and because you're going to be with that person for a very long time, hopefully. So I want parents to understand that your pediatrician is part of a health and well-being collaboration between the child, the parents, and then the extended families, because you take care of the families too. Children are a product of their families. They live with their families. So I want you to understand that it's a family affair. It's also important for parents and pediatricians to work together in the care of our most precious population, which is our children, our babies, children, adolescents. And that my hope is whatever practice or pediatrician that you choose, you'll form a long and trusting relationship while enjoying a healthy journey with your child into adulthood.
Dr. Maschantonio, thank you so much for all of your insight today. And if you're watching and have more information about ChristianaCare Pediatrics, there are links in the comments below, and you can also continue to submit your questions in those comments, and I will connect with Dr. Maschantonio and get you those answers after this live video ends. Thank you so much. Our next Let the Adventure Begin episode is about packing your hospital bag. I don't know about some of you, but I am now in my third trimester and have to get that started. So we'll be talking about that in 2 weeks with one of our nurses in the Center for Women's and Children's Health. So join us then 2 weeks from now for our next episode. Thank you so much and have a great afternoon.